This is my story about an ear problem. I thought I had a middle ear infection after recently getting a new crown put on a tooth. This is not medical advice and it's not dental advice. It's simply my story, which may help you in your situation. After the crown was installed, the permanent crown, I went back because I was having a dull ache around my ear in the back of my jaw. So they took an x-ray of my jaw and said, no, if there's no abscess, it's probably an ear infection. So then I went to my local physician, explained the situation, and she issued 10 days of an antibiotic. After 10 days, the aching had subsided considerably, but it was still there. So I called her and got a renewal for a different prescription for another 10 days. At the end of that second 10 days, then the ache was completely gone around my ear and my jaw. 2 days later, after the prescription ran out, the ache came right back. So I decided, okay, it's not an ear infection. It must be related to that crown I had put on recently. So I went back to the dentist. He looked at it and said, I got to send you to a root canal specialist to see if it's a root canal problem because we don't see anything wrong in the x-rays. During root diagnostics, it was determined that my second tooth from the back on the bottom jaw on the left side was inflamed beyond recovery. This is also the same tooth that had the new crown put on it about 3 weeks earlier. There was no abscess, it was just inflamed inside the tooth. And that was causing the pain shown here on the left X in this picture. The left X was causing that muscle pain to feed up into my left side of my face and the lower part of my ear. And once the root canal was done, all the pain disappeared. I mean, the same day the pain disappeared. So it was definitely related to that root that had not abscessed. So here's the interesting part of this story. How did the dentist test for a faulty root? It was dirt simple. I mean, anybody can do it. What he did, he took a pair of tweezers and he folded up a little piece of gauze and he grabbed the gauze with the tweezers and used some freeze mist and he sprayed the gauze till it was frosty. Then he would simply touch it to the tooth. I mean, we can do this. You could use a wart remover freeze or electronic freeze. I mean, you're not ingesting it, you're just touching it to the tooth. So anyway, that was his test. He touched it to the tooth, and the deal was he would hold it there until he started getting pain. And if he started getting pain, he'd remove it. Once he removed it, the determination was how long it took for the pain to subside. So on that tooth, as soon as he touched it, severe pain shot up, and when he removed it, the pain lasted for about 15 seconds. And it slowly dies out. So the other tooth nearby, it had to be on the tooth for 2 or 3 seconds, and it started to get a little bit of pain, and then he took it off, and the pain went away. So apparently that was a normal tooth. He said that tooth was slightly inflamed also. And he wanted to do both, and I said, no, let's just do the one that's obvious, because it may be affecting the other one. And that's how he tested the tooth. Real simple. Freeze spray, gauze, tweezers. You could also use a Q-tip and freeze spray. Touch it to the tooth, hold it there till you start to feel pain, remove it, and the pain should go away right away. If it doesn't, there's a problem with that root canal nerve. And that was my case. So this is a simple test you can do at home. You can do it yourself and save yourself a trip to the doctor, getting prescriptions you don't need, taking doses of antibiotics you don't need, and you also don't have to go to an expensive dentist, root canal dentist, just to find out what's going on. So this simple little test will tell you. Remember, my tooth had no sensitivity to normal drinking of liquids out of a glass, tap water, nothing affected it. But that freeze gauze immediately affected it. So that's the clue. Hopefully you can use this information to some way to improve your health. That concludes this video.